What is real-world data? What is the difference between real-world data and real-world evidence?
Real world data are messy. Data, plural data, datum is singular. So real world data are messy because, in real life, life is messy. Patients often, miss a dose because they were on vacation or in the hospital, or they may have gone to urgent care for an infection, and those records don't show up in the main center's data. So real world data are representative. Again, the strength of them is that they represent more patients getting treatment where they are, regardless of how healthy they are, how frail they are, what language they speak, etc. Real-world data are messier, though, because, again, of all the complexities inherent to life. Real-world evidence is what we do when we take those real-world data and try to analyze them in a way that adjusts for some of the complexities inherent to them to kind of figure out what makes the most sense for patients. And so we'll discuss several examples of that where we use real-world data, for example, in this case, through HealthTree Cure Hub to help identify a research question and to answer that question. And the answer to that question would be real-world evidence. Real world data would be just looking at a map, and real world evidence would be using that map to figure out the directions where we want to go with our trip or something along those lines.
How is real-world evidence generated from real-world data?
I think we should have a question in advance first. So the scientific method that all of you hearing this talk, learned in middle school or high school, or you may know of your children and grandchildren who've learned the same thing, is that you always start with a hypothesis. So before just seeing what happens, have a hypothesis to say, look, this is what I want to look at. And then from there, use the real world data to analyze that question. Those are your methods, and have your results and your conclusion. And even though that sounds like something out of a high school science project, that is very literally what we still do today as clinician researchers using real world data. So in my case, for example, one recent project that we'll talk about with the HealthTree Cure Hub was looking, for example, at this idea of dexamethasone, which many patients with myeloma are very familiar with, being on dex or dexamethasone once a week for weeks, months, years, and what are the outcomes of it. And there are data around that were available in Cure Hub. And so we asked a question and we said, well, is there any link between dexamethasone exposure and eye issues, for example, cataracts? And so we used the real world data to actually investigate that, and we actually did find a link that the more milligrams, the more doses of dex someone had received in their lifetime, milligrams per week, weeks per month, months per year, and so forth, the higher their risk of cataracts. And so we use that to generate real world evidence as our conclusion, saying that in the real world setting, dexamethasone and myeloma is associated with a higher risk of visually significant cataracts. And therefore, future studies should look at, can we get rid of the dex earlier for more patients or reduce the dose? So that would be a good example of where we took already available real-world data and we mined the data. We had a specific question in mind. We went and worked with the HealthTree team in this case to answer that question. We submitted to a conference, we got it published, and now it's public domain literature that hopefully will inform future studies based on that real-world evidence.